Topic Area 4. Dr.A.B.C. Dr.A.B.C is an acronym for danger, response, airway, breathing, and circulation, and refers to the steps that should be followed when initially attending to a casualty. The Dr.A.B.C procedure should be completed in the following order. Danger. It is vital that the overall danger of the situation is assessed first, to decide whether it is safe for the people involved to remain. For example, if a performer has an accident involving gymnastics apparatus, the primary danger could be the possibility of the apparatus falling. Therefore, the apparatus would need to be secured before attending to the casualty. Response. The casualty must be checked to see if they are responsive or unresponsive. The first responder on the scene should ask questions to see if they can get a response. If the casualty opens their eyes or gives another gesture, they are responsive. If they do not respond in any way, they are unresponsive and should be treated as quickly as possible. Airway. Next, the casualty's airway must be checked to see that it is clear. The airway should be opened by placing one hand on the casualty's forehead to tilt their head back and using two fingers from the other hand to lift the chin. If the casualty is unresponsive, the first aider needs to move on to the breathing as quickly as possible. Breathing. The first responder now needs to check if the casualty is breathing normally. They should place their ear above the casualty's mouth, listen for sounds of breathing, and see if their breath can be felt. They should also see if the casualty's chest moves. This should be done for 10 seconds. If they are unresponsive and not breathing, call 999 or 112 for emergency help and start cardiopulmonary resuscitation, CPR, straight away. Ask a responsible person to find and bring a defibrillator. If they are responsive and breathing, move on to circulation. Circulation. Once it has been established the casualty is breathing, the first responder should check for any signs of severe bleeding. If the casualty is bleeding severely, the first responder will need to control and treat the bleeding by applying direct pressure to the wound. Call 999 or 112 for emergency help. If they are unresponsive and breathing but with no bleeding, put them in the recovery position and call 999 or 112 for emergency help. Unconscious casualties who are breathing and have no other life-threatening conditions should be placed in the recovery position.